Welcome to the 2019 Benefit Open Enrollment for Pillar. Pillar partners with Assured Partners, a team of dedicated, experienced insurance professionals that will manage your employee benefit package. You have a dedicated service team. Should you need assistance with a claim, have a question regarding your explanation of benefits, or have a general benefit question, please feel free to reach out to Assured Partners. Sue Lofton, Member Service AE Direct at 270-393-6208 or by email at sue.lofton@assuredpartners.com. Please note that the following slides were designed to provide you with a brief overview of your 2019 benefit package. In the event of a conflict between a carrier summary and this description, the terms of the carrier summary will prevail. You and your eligible family members may apply for benefits if you work at least 30 hours per week. As a new hire, your benefits are effective the first of the month following 60 days. Coverage is also available for your spouse and your dependent children to age 26. Please check each type of benefit plan for dependent age eligibility rules. Please note that you and your eligible dependents must be enrolled within 30 days of becoming eligible. Your elections for the plan year will remain in effect for the full year unless you experience a qualifying life event. If you experience a qualifying life event, you may change or cancel your coverage during the plan year to meet your needs. You must notify the Human Resource Department within 30 days of the event date to ensure that there's no disruption of coverage. Qualifying events include birth, adoption and legal guardianship, divorce or legal separation, marriage, death of policyholder, turning age 26 and aging off a parent's plan, loss of Medicaid, FMLA-related leave, or loss of employer-sponsored group coverage. For a complete list of qualifying events, please contact your Human Resource Department. In this presentation, we will review the following: wellness, medical insurance, value-added services, flexible spending account, dental and vision insurance, life and disability insurance, employee assistance program, critical illness, 401k, qualifying events, and contact resources. Wellness life coaches through ICWS, Integrated Corporate Wellness Solutions. Sometimes we know exactly where it is we want to go with our lives, but just don't know where to start. ICWS Lifestyle Coaches will help set goals so that you can determine what you want to achieve by distinguishing between what you could do, should do, and really want to do. When you create an ideal goal, something that you really want, you're more likely to take action to achieve it. You'll have access to a coach who will work with you to help create a step-by-step achievable plan to help you reach your goals, big or small. The lifestyle coaches at ICWS will help you design a plan of action that will lead to a healthier lifestyle, help you overcome obstacles such as low confidence, insecurities, and setbacks, to help evaluate all options available for goal achievement, and they'll offer dedicated time, support, and encouragement as well as motivation. And we encourage you to contact your Human Resource Department for more information. Wellness Passport to Wellness. The Passport to Wellness, you must submit to Human Resources by August the 1st. If you've already completed an exam between August 2018 and August 2019, please submit the documentation providing the date of the appointment with a physician's signature. Now, Pillar will host a biometric screening in the spring of 2019 that will count towards your passport points. Now, submit your passport by the required date, and you can enter drawings to win monetary prizes based on your number of points. Medical insurance. Please make sure that your providers in the UMR network to be eligible for a lower cost. Your medical benefits will remain through UMR. It's a PPO plan, meaning you have first dollar copays for office visit and specialist office visit, as well as first dollar copays for prescription drugs for Tier 1, 2, and Tier 3 benefits. You have a $3,000 single deductible. The deductible comes into play when you're hospitalized, when you have lab work or x-rays. Once you meet your deductible, your coinsurance, your responsibility is 30% until you hit a total overall out-of-pocket maximum of $6,600. $600 for single coverage. This is the worst case scenario. If you had a really bad claims year, the most you'll be out of pocket is $6,600 in network before the carrier, UMR, pays for the remaining of your in-network claims at 100% for the balance of the plan year through 12/31. So again, with the PPO plan, the biggest takeaway is you have first dollar copays. You should be able to go to office visit and leave with a $30 copay unless you have lab work or x-rays performed. Again, with the prescription drugs, another first dollar copay for tier 1, tier 2, tier 3. Now, tier 4 is a specialty medication. These are typically the drugs that flash across your TV screen. These are typically the drugs that the pharmaceutical reps are pressing to your providers and the providers writing your prescription for, the newest and the greatest that are released in the marketplace. Oftentimes, these drugs haven't hit a tier 1, tier 2, or tier 3 platform yet. So what you will find is a lot of times that same specialty medication has the same ingredients that you can get by combining maybe 2 or 3 generic or combining a preferred and a generic. Again, the specialty drugs are not at a copay, but it's at a co-insurance. So you're going to pay 25% of the cost of that drug up to $200 maximum per prescription. So we want to encourage you to talk to that to your provider to see if there's a generic equivalent or even a brand or non-preferred brand equivalent that they can write in lieu of that specialty medication, because that's going to save you money if it hits a tier 1 especially. Now, out of network, as I mentioned on the first screen, we want to encourage you to make sure that you go to a UMR provider by visiting umr.com and picking a provider that's in network. Out of network, you have a higher separate $6,000 deductible, you have higher co-insurance coming out of your pocket, and a higher separate bucket for the out-of-pocket. Plus, that out-of-network provider can balance billing you for whatever they want to, and you're responsible for the bill. So it's not good to go to an out-of-network provider. Preventative care is covered at 100% in network. Now, preventative care includes immunizations, well women checkup, well child checkup, mammogram, blood pressure tests, cholesterol tests, and certain tobacco cessation products for those 18 years of age or older. Now, the key to preventative is that the provider has to build a claim as preventative. If you were to go to a preventative care service and you started talking about your back hurting or they're checking you for a certain cough, oftentimes that provider will bill you as a sickness code. Therefore, it's going to be subject to your copay or your deductible, depending on what services they perform. But if you limit your preventative care service to a preventative care visit, you should walk away and not owe anything for that call. Things to know about the PPO plan. Again, the co-payments are immediate. That includes office visit and prescription drug co-payments. The co-payments do not apply towards your deductible, but they do that overall out-of-pocket limit. That's a worst-case scenario that I reviewed with you. And note that dependent children are eligible for coverage through age 26, regardless of full-time studentship or marital status. And again, check the UMR network to make sure that your provider, whether it be a provider's office or an urgent care clinic or a hospital, make sure they participate in network. Non-emergent use of the emergency room. In your medical plan documents, there's language regarding prudent person lay law. And that language states that if you go to the emergency room for a non-emergent situation, carriers can deny your claim. We are seeing carriers deny claims. Now, if your claim is denied, you have the right to appeal, but we're also seeing several appeals also be denied. So what that means to you is that you may be responsible for the entire emergency room bill. We want to encourage you to seek emergency room treatment for true emergencies. If, however, the condition is non-emergent, we want to remind you to seek care from your primary care provider or by using the UMR Teledoc service. Effective January 1st, 2019, this is the pricing. As you know, the cost of healthcare is escalating. That's why we want to encourage you to utilize the wellness services that Pillar is giving to you. Pillar itself, as a company, as your employer, values you. They are paying this amount in the first column towards your monthly premiums. This is how much your employer is paying for your coverage depending on your enrollment. Your cost per pay period is in this column. If you have single coverage, it's $50.81 per pay period, employee spouse, employee children, And then family coverage. Remember that dependent children can be covered through age 26, regardless of full-time studentship or marital status. This is the pricing per pay period effective January the 1st, 2019. Flexible spending account through WageWorks. Flexible spending accounts allow you to pay for out-of-pocket medical expenses and dependent care expenses with pre-tax dollars through a payroll deduction. On an average, an employee saves 25 to 30% in taxes on this money. Now, for example, $1,000 in dependent daycare expenses may only impact your net pay by $700 to $750 instead of the full $1,000. Under the flexible spending account, you may make a contribution towards the medical plan up to $2,700 per year, and the per year is January 1st through December 31st, or into your dependent care account for $5,000 for eligible child care expenses. Example of eligible medical expenses are deductibles and co-payments, co-insurance, eyeglasses, and dental expenses. Now note, if you set aside funds, you must use the funds or you will lose the funds. That's how the FSA works. This is a sample of qualified FSA expenses. You may use them to pay for certain health care, dental care, vision care, or even over-the-counter medicines and drugs. This is a partial list. You can go to the irs.gov website and pull up a full list, but it includes acupuncture, which is not covered by your medical plan, insulin, drug prescriptions. You may need some braces. You may need a new pair of eyeglasses. And of course, when you get over-the-counter medications and so forth, you can use it for eye drops, baby rash ointment, acne treatment, several things. All of this can be used with your FSA card. And your card is just like a little debit card. You'll swipe the card at the point of service. Value-added services through UMR. Again, we said several times, you need to look for a provider by going to the UMR.com website. It's very, very simple to do. You can look for a provider by a category. You can search for people by their names. You can search for places, testing, imaging, services of treatment, or even condition by care. So if you want to look for a specialty doctor, you can certainly plug in your zip code. It's going to pull up a list of specialty doctors, unless you have a particular doctor by name that you want to search for. You can also go to the UMR.com website and access your claim results. What you're going to see is any claims that you have, it's going to have an assigned claim number, it's going to have a service date, it's going to show what the provider billed and what that provider, being part of the UMR network, is supposed to write off. It's going to show what UMR is going to pay and then your responsibility. So no more lost EOBs or explanation of benefits in the mail. You can find out what you owe. It's all safe and secure. It's just another feature on the UMR website. You can also live chat 24/7 with a UMR representative. In addition, as I mentioned in one of the first slides regarding a teledoc service, UMR offers a teledoc service. You can talk to a doctor anywhere, anytime, 24/7, and usually you're done within 10 minutes. Now, this is excellent when you oftentimes have to go to the emergency room because your urgent care clinics are closed. You cannot reach your local provider, and perhaps it's the weekend, or perhaps your child has a high fever at night. You can do a virtual visit for non-emergent care by connecting by phone, video, or mobile app. Again, it's 24/7, and you'll elect a physician from a network of qualified family physicians, and if that physician can treat you, you'll pay the equivalent of your copayment at the point of service, and then if a prescription is needed, they can call in a prescription to your local pharmacy, and you can pick that up. So it is just a very low-cost alternative to going to the emergency room or even an urgent care clinic. What I do encourage you to do, if you're already enrolled in the UMR and you haven't registered, go ahead and register, because if you're running a high fever, you may not feel like going through a simple enrollment process. And then that way you already have your login. So when you're ready to use the service, you'll just go to your device, you'll request a visit, and then a teledoc will be available to you. And again, the doctor will help diagnose your symptoms and even prescribe medications if needed. General health issues for Teladoc service would include colds, flus, allergies, strains, sprains, digestive issues, sinus problem, pediatric care. They cannot treat you for anything that's going on under the skin. So if you think that you have a broken bone, by all means seek other treatment. The Teladoc cost, again, is the cost of your copayment. So this is not accurate for your plan. It's going to follow the primary care copayment. I do encourage you to keep this toll-free number handy because you may be on vacation, you may not have the information with you, so that if you did have to visit Teladoc, you could. What I like about Teladoc is that with my local urgent care clinic, nothing is urgent about it. If I go to urgent care, I want to be treated, and I don't necessarily want to be in a room of other sick people. So it meets my needs. I can be, I don't have to miss a lot of work, or if I am off work, then I'm not spending a lot of wasted time waiting to be seen by a doctor. I can be done usually within 10 minutes, and again, go pick up my prescription, and I'm on with my day. It's a wonderful service to use. Also, with UMR, you have an Epic Hearing Healthcare, and what that is, it gives you discounts on hearing products and services. It's a national network of physicians and audiologists, and you could save 40 to 50% on hearing aids. So there's a separate toll-free number as listed on the screen for you to utilize that benefit. Don't pay too much for your prescriptions. Prescriptions can be costly. Now, GoodRx is something that we want to tell you about. It's a good resource for less expensive prescriptions. It's an excellent alternative, but it isn't your health insurance, and it's not going to be used in addition to your health insurance. What we recommend GoodRx for is you can go to the app at goodrx.com, type in your drug name in the search field, and it's going to pull up the cost of drugs, and in your area you can put in your zip code or your location, and it's going to pull up who's going to be the most affordable for that prescription drugs. It's going to vary from one location to another. But if you are enrolled on the medical plan, you can still use your GoodRx discount card instead of your group medical plan if the RX drug card is lower. So this is really, really helpful for those Tier 4 specialty drugs, because a lot of times you can go to this website and simply print a coupon, and the pharmacy will accept it, and then you're not paying, the full amount for that 25% drug. So it's a great resource to have if your doctor's prescribing you a new drug and you're not sure what it's going to cost you at the pharmacy. Plug in the drug. It's going to pull it up. It's going to show you how much it's going to cost. Of course, we always want, again, to encourage you to speak to your provider to say, is there a low-cost alternative that's available? Because a lot of times there are in the marketplace that can save you money. Your dental insurance. Your dental insurance will remain with Delta Dental. With the dental insurance, you have a $50 single deductible, $150 maximum, that's times 3. Let's say, for instance, if it's just you and your spouse insured, both of you would just have a $50 deductible. The maximum is on there if you have a family of 3 or more. So if you have 8 dependents on your plan, the most you'll pay is $150 maximum. And then you have a $1,000 per covered person allowance per benefit year. With this plan, you have diagnostic and preventative services covered at 100%. That includes your cleanings, your x-rays, your fluoride treatments. 100% covered, not subject to the deductible. Your deductible will apply when you have basic or major services, and this is the schedule of the payout for that. We again want to encourage you to locate an in-network dental provider by visiting deltadentalkentucky.com and putting in the Delta Dental PPO network. It's very important that you add that network. That's going to pull up a list of your providers, because a non-participating providers has it's a slightly reduced amount, but where it's really going to hurt your pocketbook is when they balance bill you, just like I spoke regarding the medical. They can bill you for whatever they want, and you have to pay that amount. So again, want to encourage you to make sure your provider participates in the Delta Dental network. This is the pricing per pay period effective January 1st, 2019. You have single coverage pricing, employee plus 1 dependent. That can be a spouse or that can be 1 child. If you have 2 or more family members insured, you must take the family pricing. The vision benefits will remain with iMed. With iMed, you have a $10 copay for exams. And then you have a material copay. Typically it's $20 unless it's a standard progressive lens or a premium progressive lens. You also have an eye exam. You're eligible for an eye exam once every 12 months. You can have a new pair of lenses, whether that's lenses for your frames or contact lenses, once every 12 months. And then you can also have a new pair of frames once every 24 months. You want to, again, make sure that your provider participates in the EyeMed network, and you can visit eyemed.com or call the toll-free number to verify that. Again, out-of-network, there's not much of a reimbursement. Stay away from out-of-network if you possibly can. There's plenty of providers to choose from in-network. With the contact lenses, you receive a $130 allowance with a 15% off the balance above and beyond $130. With frames, you have a $150 allowance with a 20% off the additional balance. This is your pricing per pay period for vision. This is single coverage, employee spouse, employee children, and family. Life insurance. Pillar provides all full-time employees with $25,000 basic life and accidental death and dismemberment insurance. Of course, Pillar pays the full cost of this benefit for you. This benefit includes accelerated death benefit. What that means is if you incur a terminal medical condition that's expected to result in a death within 12 months despite appropriate medical treatment, you may be eligible for an advancement of 10 to 75% of your life insurance. You must have been insured under the Lincoln Financial Life Insurance Policy for at least 12 months, and eligibility is subject to Lincoln Financial review and approval. This is very beneficial for those diagnosed with a terminal illness because a lot of times people want to have their affairs in order. So note that this benefit is built into the employer paid and the voluntary life through Lincoln Financial Group. Another key note here is that there is an age reduction schedule that starts at age 70. Your original benefit will reduce by 35%, and age 75, an additional 15% of the original amount. Benefits will terminate upon retirement. Again, this is the employer paid benefit. And at that time, coverage can be converted into a personal policy without evidence of insurability or health questions should you choose to leave Pillar. The voluntary life is through Lincoln Financial as well. So as a full-time eligible employee, you have the option to purchase additional voluntary life in addition to the employer pay life that Pillar provides. As an employee, you may apply for 5 times your annual base salary up to $300,000 maximum if you're under the age of 70. If you're new to the plan, if you're in your new hire event and your effective date is after January the 1st, you may apply up to $150,000 without health questions. Anything above $150,000 will be subject to health questions. Your spouse at your new hire event is eligible up to $30,000 without any health questions. Now, a spouse benefit cannot exceed 50% of your employee benefit, and it's got $150,000 maximum. Dependent children are covered 14 days to 6 months for a $250 benefit, and 6 months to age 19 or 25 as full-time student for a $10,000 benefit. It too, again, includes accelerated death benefit and has an age reduction schedule starting at age 65. Note that spouse coverage terminates at age 70. Now, with voluntary life, remember the primary functions for life insurance is to cover your final expenses, to help pay off your mortgage, replace lost income, or pay for your children's education so that you no longer be in the picture. What is it going to take for your family to maintain their cost of living at that time? So that's why it's always a great feature to have the voluntary life in place, and because it's on an employer platform, it's going to be cheaper than you can find if you were to go into to buy individual life insurance. Now, at the 2019 open enrollment, or as a new hire, you may increase your current election without any health questions. Employees can increase by either $10,000 or $20,000, and your spouse may increase by $5,000 or $10,000. So that's if you already have the benefit, you may increase without additional health questions. If you want more than those amounts, then you can do so. You can by applying with an E of I form that's answering health questions. Now, what if I previously declined Lincoln Voluntary Term Life and I want to enroll now? You may do so. If you, your spouse, or your dependent children previously declined the voluntary term life benefit and want to enroll at the 2019 open enrollment, you'll have to complete an EFI form, and you'll be subject to Lincoln Financial Underwriting Review. If they review and they will issue the coverage, if they've picked up something regarding your health that is non-insurable, they will certainly let your Human Resource Department know. What if I do not elect additional voluntary life during this open enrollment? If you're already enrolled in the benefit and you don't want to make any changes, that's perfectly fine. Should you have never enrolled in the voluntary life and you do not want to enroll at this time, you don't have to. Should you decline to enroll during this event, but you want to enroll at any future open enrollment date, you're going to have to complete an EFI form and answer health questions. None of us know what tomorrow holds, so it's your opportunity while you're in good health to apply for the additional life insurance if this is what you want. The voluntary life and accidental death rates are listed on the chart. Very, very affordable. If you were to calculate a 22-year-old applying for $50,000 in life insurance, every pay ticket will cost $2.77. Now, spouse rates are based on employee age. Disability insurance. Pillar offers all full-time employees the opportunity to purchase short-term disability through Lincoln Financial Group. Short-term disability pays you a portion of your weekly earnings if you cannot work due to an off-the-job covered injury or sickness, and that includes maternity. This is a voluntary benefit, so you're responsible for the entire premium of your short-term disability coverage. An overview is that you can receive 60% of your weekly salary up to $1,000 per week. Benefits begin for accident, sickness, maternity on day 15. That means the first 14 days are not covered. You'll need to use your PTO or vacation time. Day 15 is your day one, up to a maximum period of payment of 11 weeks. Note at the 2019 open enrollment, you may apply for the voluntary short-term disability without health questions unless you've been previously declined. Now, there is a 312 pre-X on this, and if you're enrolling in a short-term disability for the first time after January the 1st, 2019, a 312 pre-existing clause will apply. And what that means is if you've received treatment for a condition within 3 months prior to your effective date under this policy, you may not be eligible for a benefit for that particular condition during the first 12 months. But any new conditions are not subject to pre-X. Now, with short-term disability, according to the American Association of Critical Illnesses, basically statistics are showing that American families would be bankrupt if they missed more than 3 consecutive paychecks. So 48% of all home foreclosures are also as a result of a disability. So this is an opportunity, again, for you to apply for this benefit, because what will happen to you if you didn't have, if you could not work due to a short-term disability, how would you pay your bills? The long-term disability plan offers you to purchase additional voluntary long-term disability through Lincoln Financial, and it will pay due to an off-the-job covered injury or sickness. Again, it's a voluntary premium, so you're responsible for the entire premium of your long-term disability coverage. Now, with the long-term disability, it will pay 60% of your monthly salary up to $5,000. You have a 90-day waiting period. The maximum period of payment is to age 65 or reduced benefit duration, and it too has a 312 pre-X clause. Now, you at this 2019 open enrollment may apply for this benefit without health questions unless you've been previously declined. Now, one thing to take in consideration is that on an average it takes 3 years for a disabled employee to be notified if their Social Security benefit award is given to them. And back and other musculoskeletal disorders cost 29% of all new disabilities for American wage earners. And even more than that, more than 25% of today's 20-year-olds will become disabled before they retire. So this is a lot of information for you to consider, because don't wait until a disability happens and you find yourself with a gap in coverage. You have no income coming in. It's your opportunity to enroll into the long-term disability benefit at this open enrollment. Employee Assistance Program through Lincoln. You have Employee Connect services. At Pillar, we don't want you to tackle life's challenges alone. This help is free. So they can give you confidential guidance and resources for you or any immediate household member. It's for in-person help for short-term issues. You have a toll-free number and 24/7 service. You may receive an additional 25% discount on in-person consultations. These are typically telephonic consultations. And you have financial consultants, referrals, work-life services. All this is available to you. So we encourage you to go to guardianresources.com and review the Financial Employee Connect program. This benefit is offered to all full-time, part-time employees at Pillar. Aflac Critical Illness. This is a new benefit that we're rolling out January the 1st, 2019. The Aflac Critical Illness policy pays you a lump sum benefit of $10,000 or $20,000 upon the initial diagnosis of a covered critical illness so that you can pay your bills. As a full-time eligible employee of Pillar, you may elect to enroll in a voluntary critical illness benefit through Aflac. Depending on the critical illness, you may have to make modifications to your home, your automobile, require additional nursing care, or simply need the extra money to travel to and from your treatment facilities. Again, the money's paid to you, not to the provider. Benefits include cancer, heart attack, stroke, end-stage renal failure, major organ transplant, benign brain tumors, loss of sight, speech, hearing, bone marrow transplant, sudden cardiac arrest, advanced Alzheimer's, Parkinson's disease, paralysis, severe burns, coma. There's even a skin cancer benefit. There's also reoccurrence benefit. So if you are paid for the initial and you were to have a second time diagnosis, there's additional benefits available. Now, some statistics here. According to the American Association for Critical Illness Insurance, they show annually that some 1.4 million Americans are diagnosed with cancer. And every 40 seconds, someone in the United States has a stroke. Every 34 seconds, an American will suffer a heart attack. These are the benefits that are real. If your family hasn't experienced them, you probably know someone who has. That's why it's so important to take out an Aflac benefit that's going to pay you money, because your medical insurance is hopefully going to pay your doctor bills, keep the doctor at bay. But what happens when you need to pay your light bill? You still need to pay your truck payment. You need the travel money. At the 2019 open enrollment, since we're just rolling out this product, you may enroll in the Aflac Critical Illness Benefit without health questions. This is huge. You can also elect to insure your spouse for 50% of your benefit without health questions. So regardless if they already have cancer, they've already had heart disease, they are covered effective January the 1st. There are no waiting periods, there's no pre-existing condition exclusions, and no age reduction schedule. So should you also decide to leave Pillar, the benefit is portable. This is a wonderful benefit. Again, want to encourage you to consider this, because should you wait and be diagnosed with a critical illness and not have the coverage in place, you're not going to receive a payout at that time. 401k retirement savings, ADP. Pillar offers a way to start investing and provides a 100% match on your first 3% contribution. Employees who participate in a 401k plan set aside a portion of their salary as pre-tax dollars to be used for the future. You are eligible on your first year anniversary and 1,000 hours, so you can start saving for your retirement with easy payroll deductions. You can enjoy the payroll deductions coming out seamlessly. You can call a toll-free number and visit mykplan.com, because it's never too late to start planning for your future. Who do I contact? This is a contact list. I won't go through every line, but it's a contact for your medical, your prescription drug, your life disability. But the takeaway here is that should you need additional assistance with service issues, claim issues, or even ID cards, please reach out to our office at Assured Partners. As a reminder, this is your annual open enrollment. You must keep all elected benefits in place until the 2020 annual open enrollment unless you have a qualifying event. And again, with a qualifying event, as we previously discussed, you have 30 days from the date of the event to submit your paperwork to Human Resources. Summary of benefits and coverage came out with the ACA, Affordable Care Act. It's a concise document providing simple and consistent information regarding your health plan. It is provided free of charge. It's a 6 to 8 page document that's designed to help you better understand your medical insurance, but we do have simpler forms that are more easier to read, and they're called benefit summaries. So you may request a paper copy by contacting your Human Resource Department. We are here to help. If you have any questions, please reach out to us. Again, the Director of Human Resources, you may reach out to Laura Said, the Human Resource Coordinator, Dan Welch, or again, Assured Partners. Thank you for attending the 2019 open enrollment for Pillar.